For the last 5 years, medical students at LSU Health Shreveport have traveled during their vacation time to bring healthcare to rural Kenya. Now, thanks to the efforts of faculty members, including Dr. Michael Harper, the 4-week educational and humanitarian mission will be a recognized global health course, the school's first international elective.
There's been a lot of interest in having international experiences, and the SHIP group, which was formed by a group of students, has been successful at having 5 trips to Kenya, and that's been really good. However, they've not been able to get official credit for it. So to just really respond to their need was the biggest reason that I felt like it was so important to do it. What they get out of it, though, is actually experiencing what life is like in Kenya and what medicine is like in Kenya. So they get a worldview that they couldn't get any other way besides experiencing it.
The students raise money for their travel and medical supplies and spend up to 4 weeks in country.
We had a home base that was, huts that we stayed in. It was kind of like camping. And then every day we would go out and go into even really smaller villages that, we could drive anywhere from half an hour to an hour and a half to get to the village. And then we would just set up our clinic in whatever the biggest building they had, and we saw patients.
It was a really unique opportunity to be able to see how medicine's done in a different nation with different healthcare policies, with kind of a different infrastructure, and also to be able to see how diseases progress kind of without some of the modern medical advances that we have over here, just to see how things like diabetes that we see so often here in Shreveport, but when you don't have access to all the medicines, kind of what can happen if it's just kind of left to its own devices.
The actual learning experience that they get as far as medicine is very similar to what they get in our comprehensive care clinic. The student sees the patient, takes a history, does a physical exam, and presents the case to a faculty member, and then we decide what we're going to do as a plan. Now, there's a lot of differences in that we have to go through a translator. There's very few tests we can do. We can check for malaria and a couple of other tests, but they have to rely so much more on their history and physical findings. Can't just go in and get an MRI or CT scan. Those just are not available. And so their clinical skills, I think, is the real big advantage that this sort of experience adds to them, because they have to trust their clinical skills to come up with their diagnosis.
You're seeing people and all you have is, just your hands and your stethoscope, essentially.
I think that definitely this experience is going to change what I'm looking for in residencies coming up next year, and also when I'm practicing on my own. I think this is going to be something that I'm going to want to continue to do.
I can see that in my practice in the future, I'll be looking for ways to try and get involved in global health. Just because I think it's such an experience, and it's such a great feeling to be able to go and give to these people who they really have nothing over there. And I feel like I benefited as much, if not more, than all the patients did that I was able to help.